So good afternoon, everyone, and welcome to today's webinar on quality improvement, increasing cervical screening. We thank you for joining us for this valuable session, and we hope you take away some tips and ideas to support you and your practice team to implement a quality improvement activity for this PIP-QI quarter. My name is Angela Heathcote and I'm from Eastern Melbourne Primary Health Network, and together with my colleagues from the Digital Health team and General Practice team, we welcome you today. Our guest speakers for this webinar are my colleagues from MFIN, Barb Repkin and Julie Allardyce, and from Telstra Health, John Lee. I would like to start this session by acknowledging the traditional custodians on whose unceded lands that we are gathering on today, and from all areas that you may be dialing in from. I'm dialing in from the lands of the Wurundjeri people, a very short walk to the Mullumbimby Creek, where each day I'm reminded of the beauty of this area at my doorstep. From the peaceful walking bush trails to the sounds of the native bird life, such as the beautiful black cockatoo. We also acknowledge the traditional custodians of country throughout Australia and their connections to the sea and community and land. We pay our respects to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. This is our second Quality Improvement Lunch and Learn. For those that did not attend our first session on implementing health checks, the webinar is available on the MFIN website. We will share a QR code at the end of this session to access this resource. For the next two PIP quarters, we'll be promoting increasing cervical screening rates in your practice. That links directly to Quality Improvement Measure 9. If there are any QI topics you would like us to cover in future webinars, please leave any suggestions in the Q&A section or in the evaluation at the end. So what will we be covering today? We'll be reviewing the National Cervical Screening Program, quality improvement activities linked to this topic through PDSAs, how to record cervical screening and polar searches, National Cancer Screening Registry, which is presented by John Lee, our guest speaker today. And also for any questions for our presenters today, please use the Q&A section and we'll answer these at the end of the session. So let's get started. I'd like to hand over to our first speaker for today, Julie from our General Practice team. Thanks, Julie.
Thanks, Ange, and welcome everybody. The role of the National Cervical Screening Program is to reduce illness and death in Australian women from cervical cancer. This is one of the most preventable cancers, and patients can be protected with appropriate and regular screening. Women with a cervix, aged 25 to 74 years, who have had any type of sexual activity, are invited to have a cervical screening test every 5 years, either by self-collection or a clinician-collected sample. Both of these options must be overseen by a clinician. There is a link below for further information, or you can also access all relevant information on Health Pathways Melbourne. Thanks, Ange. We will now watch a short, very informative video. Thank you.
One of the best ways you can protect yourself from developing cervical cancer is by having a cervical screening test just once every 5 years. In fact, cervical cancer is one of the most preventable cancers. The virus that causes almost all cases, the human papillomavirus, can be detected with a cervical screening test. The human papillomavirus, also known as HPV, is a common infection. Most people don't even realise they have it, and it usually clears up on its own. Sometimes, if it doesn't clear up, an HPV infection can cause cell changes in the cervix, which can develop into cancer. These changes can be monitored or treated if HPV is detected early with a cervical screening test. Over 70% of people who get cervical cancer in Australia have never been screened or haven't been screened regularly. So your best protection is to have regular cervical screening tests, even if you've had the HPV vaccine. The vaccine protects against some, but not all, types of HPV that can lead to cervical cancer. To get a cervical screening test, you'll need to make an appointment with your healthcare provider. Lots of people go to their doctor for their appointment, but there are also other options, like women's health clinics, family planning clinics, and Aboriginal medical services. You have two options when it comes to collecting a sample for your cervical screening test. Your first option is for your healthcare provider to do it for you using a speculum and a brush. Your second option is to do it yourself using a simple swab. This is called self-collection, and it's available to most people due for their cervical screening test. If you choose to self-collect, you'll have support from your healthcare provider to make sure you understand what to do, that you feel safe and comfortable, and that you have enough privacy. Talk to your healthcare provider about which option is best for you. Both are a safe and accurate way to test for HPV. Your sample will be sent to a lab so they can test it for HPV. If they don't find HPV, your next cervical screening test will be due in 5 years. If your test results show HPV, your healthcare provider will let you know. They'll ask you to come back to see them or a specialist, which will involve having further tests. This is the best way to prevent cancer from developing. So, is it time for you to book your cervical screening test appointment? If you're a woman or a person with a cervix, if you're between 25 and 74, if you've ever had any type of sexual activity, and even if you've had the HPV vaccine, then you should have your cervical screening test every 5 years to protect yourself from cervical cancer. The National Cancer Screening Register will send you a reminder letter when you are due to screen. You can also ask your healthcare provider when you're due, or you can check the register through your MyGov account. Check out www.health.gov.au/NCSP for more information about the National Cervical Screening Program.
I hope you all enjoyed that information from that video, really current, really relevant. And that video is available for practices to download and can be added to your waiting room displays. So from the 1st of July 22 this year, women are able to self-collect their own sample for cervical screening under the supervision of the clinician. This is an important option that has been implemented to improve accessibility and participation in the cervical screening program. To help ensure its success, it's really important to please update your patient communications around this, your website, and reminder templates to include this option as being available. Below is a link to the National Cervical Screening Program Provider Toolkit, which contains excellent information and patient resources. Thanks, Ange. So this quarter, we are promoting cervical screening as our quality improvement activity. This is Quality Improvement Measure 9 or QIM 9 on your POLAR report, being the number of female patients who are aged 25 to 74 years who have not had a hysterectomy and who have had a cervical screening test within the previous 5 years. When we look at our POLAR data, the cervical screening rates for eligible women is 35.5%, with the national average being 37.4%, and the top 10 Eastern Melbourne PHN average being 76.74%. So why the huge difference? Cervical screening results are not always correctly recorded in your clinical information systems. They must be added to the cervical screening table, which Barb will explore soon in greater detail. There are a number of QI activities practices can do to increase percentage rates of screening. Here are some suggested activities to increase cervical screening percentages in your practice. Starting from the beginning is a discussion with all clinical staff, asking the question, are we recording cervical screening results correctly? What is your processes? Again, a most important question to ask your GPs. If you are not sure, perform an audit using POLAR to check and verify if overdue screening has been completed, but not recorded correctly in the cervical screening table of your software. If you are sure, then you can start recalling patients needing screening. You could implement the National Cancer Screening Registry through best practice or medical director, so patient screening information can be updated. We are fortunate enough today to have John Lee, Head of Engagement and Communication at the National Cancer Screening Register, who will later further explain these great resources for us. You could also implement the Walrus tool, which will prompt the clinician with a pop-up at the point of care when tests or screening are due. You could maintain up-to-date information with diligent, correct recording. Please note these are all individual separate activities that you can run across several PIP quarters. Thanks, Ange. Here is a PDSA template to get you started with multiple activities around increasing cervical screening in your practice. You can use it to help plan, collect baseline data, document and implement activities, track progress, complete activities, and importantly, maintain your up-to-date information. This PDSA template will be available for all attendees. I will now hand over to you, Barb. Thanks, everyone.
Thank you, Julie. So to find out how your practice is tracking with cervical screening, you can use your infant polar practice report. These are the reports that are distributed quarterly to all practices, or you can also find out your practice's screening rate in the PIP QI report in Polar, and we'll show you that a little bit later. But you won't see the benchmarking figures there. In your Polar report on page 4, you will see what your practice percentage is for cervical screening, along with the infant top 10 practice average, the whole of the infant catchment average, and the national average. If you see low numbers here, it may indicate a data quality issue. Next slide, please, Ange. Well, let's start at the beginning. As Julie mentioned, we need to record cervical screening correctly in our clinical information systems. Otherwise, Polar will not pick it up. The screening needs to be added to the cervical screening table. Just actioning a result is not recording a cervical screening result. And if the screening's been done elsewhere, you need to record this in the cervical screening table. There is functionality that allows you to do that. Next slide, please, Ange. These resources are from Train IT, and they're information on how to record cervical screening in best practice and medical director, and they'll be provided to all attendees along with the presentation slides. So a bit of a screenshot on how to record cervical screening, firstly in best practice. It can be done when actioning the results from the inbox. From the inbox, you need to, you'll see the little add CST result down the bottom of the screen. For this to be picked up by Polar, and you'll see in the middle of the screen if it's been performed elsewhere, you actually select the not performed here from the drop-down list. Next slide, please, Ange. Or in a patient file, you can add a cervical screening result. So select the cervical screening icon from the tree on the left-hand side. Ensure you select cervical screening test rather than pap smear. Old habits die hard. Or use the no longer requires cervical screening or opt out of cervical screening boxes if that's appropriate for your patients. Next slide, please, Ange. In Medical Director, from the holding file, you can select the result, right-click, and then you will have the option to record the cervical screening results pre-populated once you click on Add. This will then add the result to the cervical screening tab. You can also add the result to the CST table from the Results tab in the patient file in Medical Director. Next slide, please, Ange. Or in a patient file, select the cervical screening tab and use the plus symbol up the top left-hand side to add the results. You've also got the option of excluding patients from future cervical screening prompts or recalls. And the record cervical screening result will open. From here, you can add the details, or you also have the option of adding the recall as well from this screen. Next slide, please, Ange. Polar Polar can help you identify patients who are eligible for cervical screening or do not have it recorded in your clinical information system. So using Google Chrome, log into Polar with polarexplorer.org.au and then select from the reports, you then select the PIP QI report tile, which is down the bottom left-hand side of the screen. Next slide, please, Ange. So select the screening tab, and in the overview table, you will see under the QIM 9 the number of patients who have had cervical screening completed. This is your numerator, and the number of patients who are eligible, this is your denominator, therefore giving you your current percentage of eligible screened women. Next slide, please, Ange. In the middle section, you can select the orange box to select the patients who have not been screened and who are eligible. The patient list will load in the right-hand side, and this is a list of patients who are not screened or do not have their screening recorded in your clinical software. I wouldn't recommend printing the list or sending out reminders without first checking how your clinicians are recording cervical screening. Or, sorry, next slide, please, Ange. You can opportunistically identify patients who are eligible for screening using the Walrus tool. For those of you that don't know, Walrus is a point of care tool that will prompt when a patient file is open in your clinical information system. If the patient is eligible or does not have their cervical screening recorded in the clinical information system, you will see that it will prompt you with the colour coding once you select Walrus. Walrus is free of cost to all practices who have Polar installed or need to be using Medical Director or Best Practice. Currently, those are the only two that are compatible at the moment. So if you would like assistance with installation and use of the Walrus tool, you can contact the Primary Health Network Digital Health team on digitalhealth@mfin.org.au. Now going to hand over to John Lee from Telstra Health, who's going to talk to you about the National Cancer Screening Register today.
Thanks, Barb, and thanks to the team for inviting me to talk to you all today. I can see there's quite a few people on the call, which is fantastic. We'll move to the next slide. So I'm here to talk to you about the National Cancer Screening Register, which is essentially, it's a digital platform developed to underpin the Australian government's NCSP and MBCSP, so the cervical and the bowel programs, and it's designed to support the end-to-end operations of the programs to help achieve that shared goal that we all have to eliminate cervical cancer by 2035 and save over 80,000 lives from bowel cancer by 2040 if we can increase the participation rate. So legislation was passed in 2016 to enable the operation of a national register, and the national register is essentially intending to create that one single record for each participant of the two programs. So the register has been supporting the National Cervical Screening Program since 1 December 2017, same time as renewal, and supporting the National Bowel Cancer Screening Program since 2019 in November. It was the bowel screening program was previously managed by Services Australia, and the cervical screening registers, there were 8 of the registers, and they were managed within each state and territory. And on the next slide, you can see what the register actually does. So it's not just it's not like a cancer register or a clinical audit register. The NCSR manages all operations for the program. So we work with our Mailhouse and Sonic, who provide the bowel cancer testing kits, and we send out about 1 million pieces of correspondence each month. So we have access to the Medicare database as well, which enables us to identify never screened participants. So previously, the recruitment method would be to for the GP or practice nurse or somebody in general practice to encourage screening. Now we can identify anyone that hasn't screened for cervical cancer and send out that invitation, in addition to the work that the healthcare providers are doing as well. So we received the results from the labs, now in that structured format, electronic format, and we have a coding team that manages coding using SNOMED 2, and we receive about 150 cervical screening tests, 8,000 cervical histology reports, and about 90,000 bowel program test kit results each week, and then they're ingested into that participant record. And the rules engine within the register is based on the clinical guidelines. So essentially takes all of that information from either a healthcare provider or a laboratory or from Medicare and makes sure that the participant is on the correct pathway. And we have the follow-up capability as well built into the register. So this provides states and territories with alerts for the bowel program to recommend a follow-up for a participant. And we have the cervical follow-up team in-house to call around colposcopy clinics, GP clinics, to find out if we don't have a record against somebody when we know they should have taken the next action, what has happened to that person, so nobody falls through the gaps. Excuse me. On the next slide, as I mentioned, the NCSR supports all operational aspects of the screening programs. So as I mentioned, it invites and reminds eligible people to screen. It facilitates timely diagnosis by enacting the follow-up function and making sure that as many people involved in that patient's care have access to the right information. We have data and reporting, so we've got the BI tool, which is available to state and territory governments, federal government, and AIHW for monitoring reporting of the programs. And we are essentially trying to create that connected and improved digital health experience for everyone by creating digital channels and secure electronic messaging for more people to access the right data at a time convenient for them. So on the next slide, this has already been touched on, but in terms of creating that connected ecosystem, we have the functionality available through PRODA via the NCSR Healthcare Provider Portal, but we also have integrations with Best Practice Medical Director and also Communicare as well. And we're seeing some really good feedback coming through, so hopefully some of you have used the functionality and it's working well. If not, I'd really love to hear about it. And on the next slide, you can see, for any of you that haven't experienced either the NCSR HCP portal, Healthcare Provider Portal, or through the integrated software, this is what it does. On the next slide, thank you. So you can access your patient's bowel and cervical screening results. So for the cervical program, one of the most important pieces of functionality, or the most accessed piece of functionality in there, is that accessing a patient's screening history. You can also submit program forms, and included in that is the ability to reorder a test kit for somebody. So if you're having a conversation in practice about bowel screening, maybe the kit's expired, they've thrown it away, now they want to do it, there's a form in there to be able to order that kit directly to be sent to that patient's address. You can also manage the patient's details and preferences in there, so deferring, opting out, or removing an opt-out. And as I mentioned, you can order bowel kits. So this is all secure through PRODA. So even when it's through the clinical information system, there's a step to record the PRODA organization, so we know we are providing the information to the right person. And on the next slide, there's a little video. So this is a recording of me, so I'm going to pretend that I can't hear my own voice. This is a demo of the Healthcare Provider Portal. I'm now going to go through a demonstration of the Healthcare Provider Portal, and I'd just like to state that all data you see today is test data only, and there are no real patient or healthcare provider details contained within this demonstration environment. Healthcare providers access the NCSR Healthcare Provider Portal by logging into their PRODA account, and PRODA stands for Provider Digital Access, and it's an online identity verification and authentication system which is used to enable secure access to government online services. We can use several participant identifiers to find the exact match for our patient, Anna, including Anna's Medicare number, register reference number, individual health identifier number, or Department of Veterans Affairs number. And below we can see the matched participant and select either the bowel or cervical record. So We can see Anna's demographic information on the home screen, and that Anna is eligible for both the cervical and bowel programs. We're currently viewing the cervical record and can see that for Anna, there is a recommendation to refer for colposcopy and an alert that indicates higher risk and a diagnosis of HSIL. And we can access the live screening history by clicking here to gain more information on the participant's screening journey to date. So on this downloadable PDF, we can see Anna is HPV 16/18 positive with a high-grade squamous lesion suggested on cytology, which means Anna has a precancerous abnormality. So the recommendation here is to refer for colposcopy, which can now be completed by the GP in the practice system. So once Anna has been referred for colposcopy, Anna's colposcopist can enter data from the procedure into the colposcopy data collection form directly into Anna's screening record. So in the interest of time, I won't go through the form now, but essentially, once a form has been submitted, the next screening action is updated in real time, indicating that the colposcopy result has now re-triggered Anna's cervical screening pathway. So if we move over to the bowel program, Anna's GP can see that Anna is yet to complete a fecal occult blood test kit. Anna's GP can then order a kit to be sent directly to Anna's address for her to complete at home. So while we're in the patient record, we can review the demographic details for Anna, and these details are taken from the Medicare database, and with the patient's consent, we can update them to be changed for screening program correspondence. We can also update country of origin and indigenous status details, as well as updating the nominated provider for Anna. So the healthcare provider can also view any correspondence sent to either themselves or their patient from the register as well. As many healthcare providers rely on their support staff to collect information ahead of busy clinics, there's the option for healthcare providers to provide delegation so their support staff can also access the portal on their behalf. And delegation can be approved or denied through the Manage Delegation tab. And so that is a demonstration of the healthcare provider portal, but as many of you I'm sure are aware, we've got integrations with Best Practice Medical Director and Communicare, which is essentially the way that we would recommend anyone would access registered data through, because it means you don't have to go into Proda, log in, search for a participant. It's all available within the patient record right there for you to access the screening history and all the forms and the screening status. All of that functionality you've just seen is built into Best Practice Medical Director and Communicare, and there is a once-off registration to register your organization within Proda, and then that can be accessed through the clinical information system. On the next slide, this is, again, not real data. Lydia is not a real person. And this is just an example of Communicare functionality. May not be as relevant for this audience, but you can see at the top there's an NCSR button. You click on that, it opens up the NCSR record, and you can view all of the up-to-date real-time information. In best practice, the way that they've integrated is that within the patient record, it will show up in red if somebody is overdue. And in Medical Director, they've implemented it into their sidebar functionality. So it will pop up to the right of the patient record. On the next slide, these links will be sent out to you, but these are just a few links for support information. Probably the most important, if you're looking to integrate with your practice software, is to book a callback. So that's a link to book in some time with one of our experts at a time convenient for you, and we can walk you through how to register. And then on the next slide, you can see some of the uptake. So as I mentioned, we're getting really good feedback, and we've got lots and lots of users. And I think one of the most important takeaways we've had is that we used to get about 8,000 fax screening histories a month for requests for screening histories from GPs, practice nurses. And that's gone down to about 250 from 8,000, so 94% reduction. So we can see that the right people are accessing this information, and hope to see more and more of you access this way. And I'll pass back to the team. Thank you.
Thanks, John. That was a great presentation, and thanks for your insight there. So from mid-June 2022, the department started to distribute cancer screening packs to more than 8,000 general practices across Australia. These packs include 3 A3 posters, one for each national cancer screening program with reminder messaging. We asked practices to place these in waiting rooms and other places visible to patients to prompt a conversation with their healthcare provider about cancer screening. On this page, you can see there are numerous links and resources, including training courses for clinicians. So in summary, Australia is on track to be the first country to eliminate cervical cancer by 2035, but only if we address the inequities in access to screening. So to play your part in this goal, decide which of the QI activities suit your practice. Remember that increasing the practice's patient cervical screening rates may take a few PIP quarters. To support this, we'll be holding a follow-up webinar in Q1, which is between November and January. Identify what activities will form part of each PDSA and spread the PDSAs over numerous quarters. Determine how the activities will be sustainable into the future, and most importantly, ensure that you involve the whole practice team in the process so everybody is on board and everybody is involved completing the same process. With this QR code, you can access directly to the Polar page on the INFIN website. This is where you'll find all of our PDSAs, walkthroughs and Polar resources, including the last PIP quarter activity on heart health checks. So just to finish off on today's session, we're sharing with you a success story through Mooroolbark District Surgery, who shared with us how they have achieved a cervical screening rate of 73.47%. So how did they achieve these results? The practice ensures that all the clinicians are upskilled in the practice processes, so everyone is consistent. When they are actioning the cervical screening result from the inbox, all the clinicians add the cervical screening result to the cervical screening table. This is the absolute key to reaching this percentage. They add a reminder and action to the result, and the nurses operate a reminder system for screening. So you can see here, this just demonstrates a continuous improvement and sustainable process to ensure that their screening rates reach this percentage. So I'm going to pass over to Barb now, just to see if there's any questions that have popped up in the Q&A for yourself or for John.
So at this point, we only have one question. So if anyone's got any more questions, you can add them into the Q&A function down the bottom of the screen. Oh, hang on a minute. Someone's got that. So the first question is probably for John. I think it's, why don't COMPASS patients show up within the registry, please? Did you know how to answer that one, John? Or, yeah?
I've actually just written the response in the text.
Okay, sorry.
But it was essentially so that the COMPASS trial wasn't interfered with in any way. So anyone that's opted into the COMPASS trial, although the COMPASS trial is coming to an end and we're starting to migrate the data that was held within the COMPASS trial onto the participants' National Cancer Screening Register record. So it will be a more full, complete record now that that trial is coming to an end.
Thank you. We don't have any more questions at this point. Oh, hang on, another one. Is there an option for bowel screening kits to be sent to the GP clinics instead of kits being sent to the patients at the home address?
Another one for me. I know this is cervical specific topic, so I was probably a bit cheeky including bowel in my presentation, but it's good information anyway. So bowel screening test kits at the moment, they are sent directly to the participant's address within Medicare, and that can be updated in the portal or through the clinical information system. But there was a Menzies trial that commenced, I think, in 2019 or 20, where they issued kits to the practice, and the practice could hand out kits and make sure that the register was informed when a kit had been handed out, because, of course, they're not barcoded if they're just handed out. So we're looking, well, the Department of Health are looking at implementing, following that trial, a solution to be able to order kits that are sent in bulk to the practice that can then be handed out to participants. So it's called an alternative access model. I think that sounds a little bit technical or project speak, but it kind of makes sense. So we don't have a date for when that will actually go live just yet, but that's something that we're working on and will hopefully play a big part in increasing participation.
I think the next one's for you as well, John. Hello, am I correct in understanding that PRODA can be integrated with Medical Director?
Right. So when I talk about integration with Medical Director, I'm referring to the National Cancer Screening Register. So it's an integration with the register itself. But the way to integrate, you have to register your organization within PRODA. So when you go onto the healthcare provider portal as an individual, you're going in and you're searching for your patient. But if you want to integrate, you have to set up the functionality in BP or MD, and there's user guides on that as well. And then you have to go in, the responsible officer for the practice has to go into PRODA and register their HBIO, so the register the organization within PRODA, and that then gives delegation and that responsible officer the right to access, and all the people within that practice the right to access the National Cancer Screening Register data within their patient records. So I know that sounds a little bit complicated, but if you are really interested in integrating the register data with your clinical information system, one of the links in the resource kit that you will receive is to be able to book that appointment with somebody to walk you through the steps.
Oh, that's amazing for practices to be able to contact you directly and do that, because I think that it will help a lot. I don't have any more questions at the moment, so unless anyone's got anything else, I just want to also recognise and thank Mooroolbark District Surgery for their contribution in letting us showcase their data. So thank you.
Thanks, Barb. Well, thanks, Barb and Julie and John, for your presentation, and everyone for your attendance today. We hope all your questions were answered, and everyone from this webinar will receive a follow-up email with a copy of the presentation and any relevant resources. If you do by any chance have any questions post the event, please contact our teams. We actually have obviously the two teams. We've got their details up on the screen. Please remember that your PHN is here to help you at any stage, so please take note of this. Obviously, we'll get those details in your follow-up email. We'll be